Case Study Number 7. Summary. Michael Johnson, a 58-year-old male. Michael presents with severe right upper quadrant abdominal pain, nausea, vomiting, and jaundice. He has a history of alcohol use disorder. Current situation. Michael arrives at the emergency department with severe right upper quadrant pain that started suddenly, accompanied by nausea, vomiting, and yellowing of the skin and eyes. His vital signs are: blood pressure 140/85 of a millimeter of mercury, heart rate 105 bpm, respiratory rate 22 breaths per minute, temperature 38.1 degrees Celsius 100.6 degrees Fahrenheit, oxygen saturation 97%. Questions. Question 1. What are the potential diagnoses and pathophysiology for this patient? Answer A. Acute cholecystitis. This is the inflammation of the gallbladder, often due to a gallstone blocking the cystic duct. Pathophysiology includes increased pressure within the gallbladder, leading to ischemia and inflammation. Key points include recognizing symptoms and the need for surgical intervention if necessary. Answer B. Acute pancreatitis. Pancreatitis is the inflammation of the pancreas, often related to alcohol use or gallstones. Pathophysiology involves the premature activation of pancreatic enzymes, leading to autodigestion of pancreatic tissue. Important considerations include supportive care and addressing the underlying cause. Question 2. What immediate nursing care is required for this patient? Answer A. Acute cholecystitis. Provide pain management with analgesics as prescribed. Administer antiemetics for nausea and vomiting. Monitor vital signs and assess for signs of sepsis. Prepare the patient for possible imaging studies, for example, ultrasound and potential surgical consultation. Educate the patient on the importance of avoiding fatty foods. Answer B. Acute pancreatitis. Administer 4 fluids to maintain hydration. Provide pain relief with analgesics and antiemetics as needed. Monitor vital signs and assess for signs of systemic complications, for example, shock. Educate the patient on the importance of abstaining from alcohol and following a low-fat diet. Question 3. What diagnostic tests and treatments are necessary for this patient? Answer: abdominal ultrasound. To evaluate the gallbladder for stones and assess for signs of cholecystitis. CT scan of the abdomen. To assess the pancreas and surrounding structures for signs of inflammation or complications. Liver function tests, LFTs. To evaluate liver function and assess for jaundice. Serum amylase and lipase. To assess for pancreatitis, elevated levels indicate pancreatic inflammation. Complete blood count, CBC. To assess for infection or inflammation. Electrolyte panel. To monitor for imbalances due to vomiting and pancreatitis. Medication information. Analgesics, for example, morphine. To relieve severe abdominal pain. Considerations. Monitor for signs of respiratory depression and educate the patient on the use of pain medications. Side effects: respiratory depression, constipation, drowsiness. Contraindications: severe respiratory insufficiency, acute or severe bronchial asthma. Antiemetics, for example, ondansetron, to relieve nausea and vomiting. Considerations: monitor for effectiveness and educate the patient on the use of antiemetics. Side effects: headache, constipation, dizziness. Contraindications: hypersensitivity to the drug. Antibiotics, for example, ceftriaxone, to treat or prevent infection in cases of cholecystitis. Considerations: monitor for signs of infection and educate the patient on completing the full course of antibiotics. Side effects: diarrhea, rash, allergic reactions. Contraindications: severe hypersensitivity to cephalosporins. Pancreatic enzyme supplements, for example, pancrelipase, to aid digestion in chronic pancreatitis patients. Considerations: monitor for effectiveness and educate the patient on taking enzymes with meals. Side effects: nausea, diarrhea, abdominal cramps. Contraindications: hypersensitivity to pork proteins. For fluids, for example, normal saline to maintain hydration and electrolyte balance. Considerations: monitor fluid status and electrolyte levels, adjust the infusion rate as needed. Side effects: fluid overload, electrolyte imbalances. Contraindications: severe hypernatremia, severe hypervolemia.